All right, Simon Munyao Muia here, talking about mental health in families as a part of my research. I'll be talking about how mental health affects families and also the treatment current and also the history of treatment and also what's happening currently. So some definitions. Mental health is huge, and mental illness has a huge spectrum. Talking about PTSD, that is post-traumatic stress disorder, anxiety disorders, and depression. Major depressive episodes, generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, bipolar, unipolar, other related disorders, psychosis, schizophrenia. All those are under mental health within families. The fact of the matter, according to WHO, World Health Organization 2017 report, says that depression is the single most largest contributor to non-fatal health loss. So the development of treatments have a very important role in the health implications of the society. Talking about acute, just to define this further, PTSD or even acute stress disorder and post-traumatic stress disorder are the kind of disorders that come to the fore as a result of an exposure to traumatic or stressful events. Whereas psychosis or schizophrenia has this aspect of the patient having some delusions, hallucinations, disorganized thinking, grossly disorganized or abnormal motor skills and behavior. You're having this sense of ovulation, which is called avulsion, which means decreased in motivated, self-initiated, purposeful activities. So you also have this aspect of the bipolar and unipolar and related disorders. Bipolar is actually shows itself in mania and depression, where the patient or the person has aspects of risky behavior and also coupled with depression and depressive moods. Anxiety also has the symptoms of fatigue, irritability, restlessness, difficulty in sleeping, and so on. So all these are mental illnesses that affect not only the individual, but the family at large. So they are not just isolated to the individual, it affects the family in one way or another, and I will talk about that. But let's look at the history of treatment. When I look at the history, it has this cyclic kind of progression. It's not linear. It's not one thing that people think it's a supernatural attribute to it, and we need to call the gods to or appease the gods, or it's an issue of sin. Other people actually get to a point where they think it's more psychogenic, where it has to do more with stress or something that is outside the person that has caused that. Then other people come to a point where they actually think it's a clinical aspect, which now they call it a somatogenic aspect of it. So there's a cyclic aspect. So you find in the earliest aspect of it, it was seen as a supernatural, it was explained as a supernatural phenomena, where actually people's skulls will be drilled so that you can exorcise or remove the evil spirit from this person. That was called the trephination. Then you have the Chinese having this yang and yin kind of explanation where these two forces are imbalanced in the person. So that is more supernatural explanation. Then now you get to a point where in this Mesopotamia area, Egypt, they are saying, no, this is actually a somatogenic problem. where women who were psychotic or had this kind of disorder, mental disorder, were seen to have a wandering uterus that needed to be taken back to its position for them to stop having this kind of manic kind of experiences. Interesting. Then now you go back, it revolves back to the supernatural kind of explanation where people saw it as return to supernatural theories of demonic possession, godly displeasure to account for abnormal behavior that was beyond the personal control. So now remedies were called the religious people to come and exercise, or religious ceremonies to be performed as confession of sin, repenting, so that this person can be released from this kind of manic kind of behavior. Then later on, you go back to the somatogenic. I'm telling you, this thing was cyclic. It was not linear. It's not one thing to the other, but it goes back to what people thought earlier on in Mesopotamia or the Egyptian kind of era, where they say, no. This guy called Hippocrates say there's an imbalance between the three bodily fluids, that is the blood, the yellow bile, and the black bile, and the nymph. And if there's that in imbalance, then there is that aspect of someone having these manic kind of experiences. So it was treated more at home with the family members around, but the state had nothing to do with the treatment of the patients. That was as far as 400 BC. But later on, a Greek physician comes by the name of Galen and says, no, actually, this is more psychogenetic rather than somatogenic. So it goes back to thinking this is actually more about a potential cause of abnormality, which is psychological stress rather than anything else. So now you go back to the 11th, 15th century, and they go back to the supernatural, because there is these natural disasters, plagues and famines are ravaging people and creation, and people like the gods, the demons have come to visit some people, and the treatment is by prayer, relic touches, confessions, and atonement. Then the church also comes in as well in the same period and says, ban the witches. So the women who have mental illnesses were actually categorized to be witches. And actually a book was written, a manual. It's called Malleus Maleficarium, that was to guide people on how to witch hunt, literally witch hunt. Over 100,000 women were burned to the stake. Then after that period, you see this animalism kind of confining those who are sick, together with the poor, the homeless, and unemployed, and criminals together, away from the society. Because they explain it not in a supernatural way, but they say this is a clinical aspect, is a brain damage or something that needs to be repaired. Then, of course, there's the freedom rights, humanitarian reforms. They more explain it as a psychogenic problem in the 18th century. So there's more humane treatment of those who are ill, there's compassion care, and so on. Then later on in the 19th century as well, there's this tug of war between, is it a clinical somatogenic problem, or is it a psychogenic problem? So later on in the 20th century, you still have that tug of war, but now more schools, over 400 psychotherapy kind of schools were instituted, and many people were being trained into the same thing. As a matter of fact, it's only until the 1980s that PTSD was diagnosed as a mental illness, actually. So later on, you see that by and large, depression, anxiety is a big, over 300 million and over 250 million people suffer, according to the World Health Organization report of 2017. The approach from intrapersonal, meaning it was more individualistic, individual focused, because they felt that secondary traumatization of this individual will cause more problems. Then also PTSD was not recognized as a mental disorder or didn't even have a thorough diagnosis by the. It started in the 1980s, hence on, but before that, it was not actually recognized as such. So treatment, family-focused therapy started taking root. Family supporting behavioral family therapy started taking root. Supportive family therapy as well took root. So you have this cognitive behavioral therapy that focus more on the family, which proved to be quite efficacious. Systematic perspective, how it affects the society, cultural, spiritual, familial, and marital systems. The thing is that the individual may have been born with a certain psychological disorder, but certain stressors need to be present for them to develop the disorder. And that's why those are societal problems, the poor living conditions, economic unrest, problem of problems of interpersonal relationships are also viewed as contributing factors. So moving on, you find the systematic perspective of social support, familial accommodation. Families now get to a point now they have to accommodate this person. Whether they know how to deal with that or not, it's a secondary matter, but families have to accommodate this person. Is it a chicken or egg kind of thing? Is it that the relational problems cause PTSD, or is it that PTSD causes relational problems? But the truth is that the relationship that an individual forms with their romantic partner or the family members is among the most important and long-standing interpersonal relationship. Hence, a person's well-being affects the quality of their relationship. So mental health increases with conflict, stress, extreme stress. Actually, veterans with PTSD, post-traumatic stress disorder, would come to seek help after they realize that they're having family problems and relational problems. So it's interesting that the family problems lead them to seek help. So divorce rates increase, more discord in intimate relationships, less self-disclosure, less parenting satisfaction, and more domestic aggression. All these are the consequences and the systematic perspectives of mental illnesses. Current practices, that is, treatment protocols in counseling and psychological fields, which have really helped. We have all these. We have the Bowenian, we have the strategic family therapy, structural, psychodynamic, contextual, experiential, solution focus, cognitive behavioral family therapy, narrative family therapy, integrative Christian family therapy. Then this aspect of conjoined rather than couple or individual kind of therapy is really efficacious, very, very effective, where you find that their partners or the person, you have to look at also the siblings and parent, adult, child relationships in that cognitive behavioral conjoined therapy. Then you also have this kind of written exposure therapy that is quite effective, where the person is gradually also narrates, or that's narrative therapy, but also is gradually exposed to those aspects that trigger the PTSD in them, and gradually they're able to overcome through exposure. So exposure is a central component of efficacious CBT, that is cognitive behavioral therapy programs, for all of the anxiety disorders. So those are some of the things that I've come up with through all these. These are some of the references that I have. I pray that this has been helpful and quite a lot to also ruminate on. Thank you so much.